Welcome back. This is Global Health, and I'm Gail Fraser. This is Unit 12, and this is, I'm sorry, we're going to be starting with Part 1. I see I have it on the wrong slide. We're going to be talking about wellness centers as they relate to HIV care. So today's discussion, we're going to be talking about human immunodeficiency virus, or HIV, and human rights. We're going to have a case study where we look at South Africa in contrast to Guyana, which of course is in Latin America, and Mozambique, which is in Southern Africa. Wellness centers, or people living with HIV, so PLHIV, people living with HIV-friendly HIV/AIDS care and treatment centers, and then a practical exercise. And actually, every year, this is one of my favorite exercises where you actually plan a voluntary counseling and testing site. I did some work in Guyana for an HIV initiative that was sponsored by the U.S. government in Guyana, because Guyana, Trinidad and Tobago, and Jamaica, the Anglophone countries in the Caribbean, they have a very severe problem with HIV/AIDS. And so there is a lot of money being spent to try to use prevention strategies. So, and I think that it's one of the practical simulations that we have. And most students get maps out and they start planning, and it's really quite an interesting process. So let's talk about immunodeficiency virus, or HIV, and human rights. We've mentioned it several times, and in the past 25 years since HIV/AIDS pandemic began, so only 25 years ago, so we're looking at 1980s, more than 25 million people have lost their lives to the disease. That's a lot of people. An estimated 3.86 million people, so almost 40 million people worldwide, are currently infected with HIV. So that means that these are people that are actually surviving, that have the infection. Each year, an additional 4 million, so the population of Bogota, basically, without your suburbs, are infected with HIV as new cases. And of those, 700,000 each year are children. In sub-Saharan Africa, HIV has drastically reduced the adult life expectancy. Basically, it has taken out most of the young adult, most productive health workforce. So you have people that are older and retired, and then you're missing a whole chunk of people, and then you've got your very young people or teenagers. And of those, we also have 15 million children who have been orphaned. So the fact that these children are left without parents is a very, very serious problem, and there's no one to support them. And they don't have a lot of free public services, so schools cost money. So aunts and uncles who are now taking care of these children, they don't really have the resources to support these extended families. The Women's Rights and Voluntary Counseling and Testing, or VCT, it's actually a shadow over the continent. Public health, HIV/AIDS in Africa, we're talking about sub-Saharan Africa, in the 21st century includes evidence that some women are refusing HIV testing because it only is a lose-lose for them. They feel like if they get identified as HIV positive, then the stigma, discrimination, and potential consequences, domestic violence, sometimes they're abandoned by their family, or they're actually threatened to murder. So women in many places, including sub-Saharan Africa, are opting out. They're saying, no way, you're not going to get me to test. I don't know if I'm positive, and I don't want to know. So that's opting out. Then some countries have policies of actively opting in. So they protect informed consent. So just like when you go and have treatment here in Colombia, your physician has you sign documents saying that you understand what treatments you're getting. That's informed consent. So informed consent and confidentiality of your records is very important, especially when you're talking about fatal illnesses. HIV is not something that can be cured, just like hepatitis C. It's going to cause you to die prematurely. It's a fatal illness. And so people have a lot of different reactions to individuals with HIV, including being afraid, or again, these are stigmatizing type of health conditions. And so clients are actively opting in and seeking HIV testing and counseling because they also know, as we mentioned when we talked about HIV before, was that you get tested and then you get treatment. Now, treatment is not a curative treatment, but it actually makes you feel healthier. It lowers your viral load so that you can be active, you can continue in the workforce, you're less infected, so you can continue with your family and have almost a normal family life. So these are the things that people look forward to. So get tested and get treatment. So we would rather people actively opt out. That means that everybody is included in voluntary counseling and testing unless they actively say, no, I don't want to have the test. That way most people go ahead and have testing. Public health links to human rights, we've emphasized that in this course and how closely they are allied. The United Nations AIDS Foundation reported health services are needed to respond effectively to major causes of preventable health conditions, so especially among people who are poor or disadvantaged in some way. Strengthening the public health functions to create conditions necessary for health or facilitate people seeking health care, and implementing equitable health care financing. So again, it's not just getting to the free services. Sometimes it's the bus fare or the length of time they need to be away from work in order to even go to health care services. So these are all things that you have to keep in mind when people are the poorest of the poor. Using basic human rights to combat HIV/AIDS pandemic, they can strengthen laws. So again, equity, rights to liberty, privacy, and non-discrimination, provide access to treatment so that the essential element of securing the rights of people who have contracted AIDS, and protecting human rights of disadvantaged groups who will also have help slow the rates of HIV. So these would be people with high-risk behaviors. The need for care rather than the ability to pay. So again, they're hoping people will provide services. Governments, United Nations, World Bank, different organizations pay for and finance health care. And HIV care and treatment should be free to encourage people to take advantage of those services. Get tested, get treatment. The three related components are women's health, because women tend to interact with the healthcare system more often because they are themselves wanting to maintain their health, but they also are having children, so they interact when they have their babies. They have their children themselves that they take for immunizations. So our men are much more out in the workforce or far away, but the women are interacting with the healthcare system, so we take advantage of that and talk to them when they come in. Active case finding. So if you have a hospital ward and you notice a child has come back many times with different kinds of infections, you could be suspicious that they might actually be HIV positive and go ahead and be able to do active case finding to identify that child or that chronically ill person, because their viral load with HIV lowers their immunity to other conditions. And then active therapy treatment for tuberculosis. So we look at sexually transmitted infections and tuberculosis as being the indicators that they also might be HIV positive. Community-based approaches to HIV treatment. Again, you need to be focusing on resource-poor situations. So, say, the West case point in South Africa near St. Elizabeth. Those are very, very poor families. They're not in the Pretoria, they're not in Cape Town. They're in the very remote rural areas of South Africa, and they need to have free services that are accessible. And one of the things that they tried and was very successful in South Africa were wellness centers. Ah, what a great idea. HIV care and treatment centers that are wellness centers. They're trying to promote health among individuals that are HIV positive, because if they stop taking their medications, they stop having adequate nutrition, they will die prematurely as young adults. And millions of people have died from HIV. They get discouraged, it's very complicated, the treatments, they sit there and stare at this big huge box. Have you ever seen one of those boxes, pill boxes, that's a whole big rectangle, and it has like 5 times a day that you take your medicine for every day of the week? It's daunting to watch these young adults look at this huge box that's full of pills that they have to take in order to maintain their health. So people do not do well with treatment. They find it to be a difficult road. So wellness centers, they have a community of people that are HIV positive. Everybody's trying to help each other and get good exercises, they actually come in, they can get food, they can get tested to see how they're doing with their medications. And so they will really have been very successful. It's a positive way of looking at HIV as a chronic infection, just like hypertension or diabetes are chronic infections, or not infections, but diseases or conditions. The HIV is a chronic condition. In South Africa, I'm hoping to contrast Guyana to Mozambique because they have different systems. So we'll be talking about the second phase for our case study in part 2. This is Global Health, and I'm Gail Fraser. This is Unit 12, Part 2, and we're going to be discussing our case studies now. So let's start off with talking about Guyana. Of course, you know that here is Colombia, and Guyana is just right here next to Venezuela. So it shares a border. Actually, they have regular disagreements about exactly where that border is with Venezuela, and then, of course, with Brazil. And I think that Guyana, like many countries that have very high rates of HIV positive individuals, they blame it on the Brazilian sex workers who come across the border. It's kind of like people in Indonesia, which is a predominantly Muslim country, blaming HIV problems on the Thai fishermen who come down from Thailand. It's just very unrealistic. They've got their blinders on to pretend that they don't have a problem and that they are not responsible for taking care of the HIV prevention and different strategies that have been found to work well in other parts of the world. Colombia does not have a big HIV problem. I guess the preventive strategies that they've implemented in a lot of the Latin American countries, the Spanish-speaking countries, have been very successful. So Guyana is just a carryover, a former British and Dutch colony. It is one of the high prevalence areas in Latin America. So Guyana is the highest HIV prevalence rate in the whole region. Out of a population of less than 1 million, there have almost 20,000 people in Guyana that have HIV. In 2008, so these statistics are probably have changed some, and unfortunately probably have gone up. So 1.5% of the pregnant women who are screened just through routine screens are HIV positive. 15% of young men and women clients with sexually transmitted infections. So if they come in for gonorrhea, there's a good chance that they would also be HIV positive. 22% among patients with tuberculosis, because as I mentioned, when you have HIV, you have lower resistance to many infections, and even certain types of cancers are more likely to occur in people with HIV. So they're more susceptible to tuberculosis. 27% among female sex workers. So you've got men and women who are commercial, meaning they receive money for sex work. And so 30%. Now that is huge. That is very high for any place in the world. In contrast, we've got Mozambique. So Mozambique, here's the northern part of Africa. So that's Algeria, Libya, Egypt, Sudan, Chad, Niger, Mali. These countries are more Arab than and most of the people there have different cultures and they're predominantly Muslim. Whereas when you go into the sub-Saharan, so the Saharan desert goes right across the top here. As soon as you go into Burkina Faso, Nigeria, Central Republic of Congo, all of sub-Saharan Africa, they have a serious problem. So Mozambique is in the western, the eastern portion of Africa. It's more allied to the southern portion. When you think of East Africa, you usually think of Kenya, Tanzania, Rwanda, Uganda. This is considered part of East Africa. The Horn of Africa is Sudan, Ethiopia, Eritrea, and Djibouti. So this area here, so they called it the Horn of Africa. Southern Africa tends to be these countries here. So Zimbabwe, Botswana, Namibia, South Africa, Lesotho, Swaziland, and sometimes Mozambique is included in the southern part of Africa because it's a long, slender country. So you can see that it's quite a big country, and it's actually very mountainous. And this is one of the reasons that Mozambique is a difficult area to work in for any type of infectious disease prevention, but especially for HIV, because you've got a lot of remote areas that are difficult to access, and it makes the fact that they have fewer health clinics and ways that they can receive information about HIV prevention. Mozambique has a population of 20 million, so quite a bit bigger than Guyana, and it is one of the highest poverty rates, so it's a very, very poor country. It's a former Portuguese colony, so they still speak Portuguese there, and it became independent in 1975, and then it had a decade-long civil war, so it lost a lot of resources at that time. The per capita income average is less than $300 per year, and that's one of the lowest in all of Africa. The high prevalence of HIV infections includes tuberculosis, malaria, and combined poor health care limits life expectancy. So again, the average life expectancy in Mozambique is only 47. That's really low, because most of the countries we were looking at, 70, 67, 80, 47 is, you're a young, middle-aged person. An estimated 1.6 million people are HIV infected, and that has a seroprevalence rate, just normal population, of 16%. So it's less than the 20% that we were finding in Guyana, but still very high. The healthcare system, primary healthcare services, are generally delivered at just the clinics that may not be open every day. So Tuesday and Thursday, they have a nurse there. The health system suffers from significant human resource shortages, so that means that, again, with life expectancy being so short, the young adults who are qualified as nurses or physicians, there are just too few of them. 700 doctors for the whole country, 4,000 nurses, so it's not high per person. because it has a fairly populous. The health centers, they have rural hospitals, provincial hospitals, but again, the main centers are in Maputo, which is the capital, and you may see the capital here. Where is it? It's not mentioning it, but it's quite far south. So you've got all this northern portion that basically has limited services. Again, we want to emphasize the successful use of wellness centers, and it might be something they've just set up. They use a lot of these shipment cargo containers, and yes, they can be very hot, and so adequate ventilation is necessary. So there are some limitations of using these metal boxes, but again, if they can get them donated, it's almost a free platform for safely being able to store tables and chairs and different types of equipment for these wellness centers. And so they are popular for use to recycle these shipment containers. HIV care and support lasts a lifetime, so it's like a chronic condition that you have to receive treatment for the rest of your life. Routine monthly and quarterly visits are necessary. Wellness centers offer counseling and a variety of health promotion and nutrition information. So again, it's a very positive way to have this continuous treatment. You join a community of people who are not threatening you. You don't experience stigma. It's a very positive experience. In South Africa, so again, here's our map. Sub-Saharan South Africa is right here on the tip, and if you've ever visited there, it is the most beautiful place in Africa in my mind. It looks a lot like California. I grew up in Orange, California, and it's got these wide open grassy fields and a beautiful jagged coastline. And of course, you've got your great whites and all those different people, the dangerous fish that migrate through this area because of the location. And so but it has beautiful beaches, and you go surfing, and they have no shark nets, so you have to be very, very careful when you're diving or surfboarding or using the beach, because the great whites do migrate through this area, and a lot of deaths do occur every year. South Africa has a population of almost 50 million, so the density of population is far greater than in Mozambique. The terrain is much more like hills, and it's suitable for agriculture, and it has great wine growing areas. It's famous for many things, including its game parks. It has an abundant supply of natural resources, particularly diamonds. It's well-developed infrastructure, fabulous highways. One of the problems is, because they have such good roads, is that people drive too fast, and accidents tend to be fatal accidents when they do have wrecks on the highway. Outside the country's 4 major cities, there's a vast majority of South Africans are very poor. So you've got that bipolar. You've got the very rich in the big cities, but then people who live in the rural areas are impoverished. 1/3 of the population lives on less than $2 a day. So those are pretty poor. South Africa has an estimated 5.5 million people living with HIV. That means that they have survived. 300,000 people living that are actually on antiretroviral treatment. And that is very, very costly treatment, especially if they discontinue treatment and come back when they're feeling much more ill. They have to reinitiate treatment with different types of drugs that are a lot more expensive. So it's quite a complicated lifelong treatment plan. And we want to have people be maintained on treatment, so they're what they would call adherent to their treatment, continuously taking their treatment. And then if resistance for those drugs develop, then they can put in what they have as a second or third line drug or combinations of drugs. So Republic of South Africa, or RSA, is seroprevalence is about 19%. So here we come back down to 19. The HIV has orphaned about 1.2 million children. So again, it's a huge public health problem to have these children being unaccompanied by parents that are caring for them. HIV is most strongly affected in women. So 1/3 of pregnant women, when they're screened routinely, are HIV positive. So that's 33%. Females of younger age are 4 times more likely to be infected than males. Here's my team, and you can see here I am smiling with my shorter hair among my different colleagues that were from Tanzania, most of them. We had some of the researchers. I think you can see the boss who's from these two people, Wafa and David. They both came over from Columbia University in New York City to just see how we're doing. But this is the team that I work with, and routinely went on field visits with at least 4 or 5 other national physicians and nurses that traveled with me to go to the different clinics. We were responsible for 30 different sites in northern and eastern Tanzania, and 10 Kenya, Uganda, and Rwanda. One of the nice things is we had 3 clinical sites that we visited in Zanzibar. So that's a beautiful place to visit, and it's part of Tanzania. So South Africa, the Columbia University in New York City has the International Center for AIDS Care and Treatment Programs, and it support prevention of mother-to-child transmission, which is PMTCT, and life-saving antiretroviral treatment. We're combating an enemy within, and so you can see the bars will not protect you from AIDS. So these are different types of promotions that make people aware of HIV. So in summary, health disparities due to HIV are linked to human rights, and positive communication is the most successful thing that you can do globally, because if people can be identified as HIV positive and receive the treatment that they need, they can actually live a longer and more productive life. And it needs to be put in a positive sense. They found that this is a much more effective way, because I know that for HIV care and treatment, I worked in South Africa, I worked in Mozambique. Welcome back to Global Health. This is Unit 12, and we're going to be doing Part 3, which is our exercise, or it's a simulation. We want you to build an HIV counseling center. No AIDS discrimination or stigma. So this is a t-shirt that we were trying to encourage people to use, especially among community healthcare workers or community members who are advocates of preventing HIV infection. Well, that was one of the major problems in Guyana, was that it's actually the nurses at the clinics or the different people that are available to help patients as they're coming in, HIV positive patients, that they treat them very badly, and the rudeness just keeps people from wanting to come in for their care and treatment. So stigma and discrimination are a big barrier for people to get their care and treatment that they need. So here is Guyana. Remember, we have our little country here on the northern coast of South America, and here are the different provinces. So you can see that the Georgetown is the capital, and it's located here. The practical exercise that I'm challenging you with is that we have our international teams, and we are going to have a grant to build and operate a new voluntary counseling and testing center. So I want you to form groups. So again, we've got our blue team and our gray team. Form groups to create a list of steps, because actually once you have the steps and the outline created, the implementation becomes clear, and the resources you'll need and the budgets you prepare for your grant proposal will be all self-evident from just the basic steps of what you need to accomplish. So number one, select a new location. So I have the maps. You have them online in your library. You have the map that has all the different currently existing voluntary counseling testing centers, so VCT site locations. I want you to select a new site based on proximity to the individuals that would be high risk. So these will be men who have sex with men, commercial sex workers, also near high schools, and HIV positive community where they're located. Estimate client volume, that's number two, because again, the location of the site is one thing, but finding an area within a regular neighborhood where you can actually either build a freestanding VCT site, or else maybe you would adopt and renovate or adapt a currently existing building, or even a residence. You could take an older home that might be available within a neighborhood that's close to a high school or some other location that you feel would be important to be near. Estimate your client volume, because you need to know how many treatment rooms and the confidential areas that you should have auditory privacy. So you can't just put everybody in a great big open room and go into different groups. You have to actually have walls and maybe at least partitions of some type of to separate individuals. And counseling rooms typically are secure areas where people could have one-on-one conversations. Recruitment of clinicians, so you need to have your nurses and your doctors, as well as counselors, social workers, whoever you think would be important for the counseling center. Phlebotomists is an example of one of the health professional or auxiliary professionals. Administrative people, they have to be trained in how to do the proper record keeping and making sure that people's status, they lock the health files. So whether you're HIV positive or negative, those records are confidential. So you have to estimate your volume. You have to look for recruiting, who you're going to need working, and how it's going to actually fit in the counseling center. And then, as I mentioned, record keeping is very, very important for the potential. If you're found to be HIV positive, you'll be given counseling about the different types of treatment options that are available, and that treatment will be given to you for free. And the ARVs, which are antiretroviral drugs, will be calculated and estimated, because once a client is in need of having treatment, or the ARVs are dispensed to them, that they have a commitment. So the Guyana government has a commitment to continue to pay for those drugs for the rest of that person's life. And typically someone that is adherent and takes their drug regularly and keeps a healthy lifestyle, they will live many, many years. They may live until they're 60. So you have a 25-year-old that's now going to live possibly as long as 60, till they're 60 years old. You have to promise, once you initiate them on treatment, that you're actually going to continue to make those drugs available to that individual. So they are allocated that money and for the resources that are required for those drugs. And those drugs cannot be assigned to a different person. So it's interesting, because the stocks and the pharmacies play a very important role in keeping track of all these drugs, because they're given for free, but they're actually, most of these drugs are quite expensive. So there are lots of resources that are being brought in from Germany and France and the United States and Australia, different organizations who donate money to actually pay for these drugs. And so you have to keep track of them, and you don't want them to be sold on the black market. So record keeping is very important. So here we are, Guyana. the initiatives they have there for the Guyanese HIV/AIDS Reduction Prevention Program, which was called GHARP, not GARP, but GHARP. I had the name wrong when I first started working for them. You can see some of the types of things that are trying to promote HIV prevention, saying respect yourself, and protect yourself. The only faithful person you really know is you, so you have to protect yourself. It was one of the successful media campaigns because, again, this is an English-speaking country, former British and Dutch colony. So here is our Georgetown map. So this is the capital city of Guyana. And remember, the population for the whole country is less than 1 million. It's quite a big country, but much of the interior is undeveloped. It has a lot of mining going on for minerals and gold, emeralds, different types of precious stones, so it actually has resources, but they're very remote sites. Most of the population is right along the coast, and we have to remember Georgetown is actually below sea level. Being a former Dutch colony, they have a whole row of dikes, very much like the wall that surrounds Universidad de la Sabana along the coast, and they have pumps that constantly pump the seawater out because Guyana, or much of the coast of Guyana, including Georgetown, is below sea level. And so it's very flat. When you're walking around, and you can see the streets are on a matrix. So I want you to take a look at this map. You can zoom in on your electronic copy, or you can get your iPads out, get your iPhones out, start looking for different features within the city. You have the locations of the current sites. I want you to choose a new site for testing and counseling, and then be able to justify why you've chosen that site. Maybe there isn't another site closer, or you say that this HIV site may be overwhelmed with work, and therefore you're going to build one in close proximity, or there might be an area like a whole bank of restaurants or even casinos, and you think, okay, well, if they're going to have casinos, they might have alcohol, and they might also have commercial sex workers, prostitutes, and therefore we would want to have the counseling and testing site there. You justify why you've chosen it, or it might be in an area where there is no testing site right now. So there are some areas you can see in this area here. It's a more of a vacant area, but also it might be underwater. There are areas that are national parks or state parks, or so that might not actually be a populated area here. It might be something. I think there is a big park, very beautiful, where you walk through, and it's got rivers and play areas, soccer fields, and so on. So you choose the site. Your building materials will be provided. So again, you're going to have a steel railroad car. So we saw an example of that. That will be approximately 700 square feet. So the internal space is quite small. Now that doesn't mean that you cannot have awnings or request to make a foundation with a patio area or seating area outside. You have to be creative because, again, you want to have throughput. This is the highest HIV prevalence in the region. So you're going over South Africa at 20%. There are going to be lots and lots of people who should be coming in to be tested. So let's figure out how we're going to get them through, and in this limited space. You're going to have a cement pad at the site, you need to designate the location and how you want to have it oriented. All necessary office equipment, including computers, HIV test kits, because that's why you need to know your volume. We're going to be looking at budgets and thinking about how many people you'd likely to treat every month or every year, however you want it, every quarter, however you want to divide it. So this is an example of a wellness center here. It was built in South Africa in a site near where we were working with the ICAP program when I was working there. And so this is much, much bigger structure than you're being given, because you're only given 700 square feet. So be creative, put awnings, make a patio, do different things that will allow you to have the client waiting areas that you'll need, because people come early in the morning and sometimes they expect to stay all day waiting for their chance or their appointment. And because it's so expensive for them to pay $2 or $3 to ride the bus to get there, they come and they spend the whole day. And sometimes they bring their children, they bring their grandmother, and so these individuals will be coming not necessarily just by themselves. So keep that in mind. You need space for families and kids to run around, and toilets for them to use, and water, accessible water. And how can you get people to have small kiosks for vending they could sell bottled water, juice, fruit, different things. So keep that in mind. I'm giving you a whole map of Guyana, and so each of these maps also has the individual voluntary counseling and testing sites and the different care and treatment sites that they have located. So you can see these are all designated by these names of their locations. Again, these are the areas that are along the coast. We've got this other map that's actually of Georgetown, and you're going to be locating your site in Georgetown. And keep in mind that HIV prevention and prevention of mother-to-child transmission are the keys. So go for it. Thanks.